Hi, I'm Dr. Sarah Gendeska. I've been a pediatrician for 15 years, and I'm the CEO of Blue Comet Medical Solutions. With my co-founder and partner, Rashmi Baptiwale, a career software engineer, we have designed the only non-invasive, user-friendly medical device for the diagnosis of strep throat. We're currently in the concept stage, but we have received funding from the FDA through the Southwest Pediatric Device Consortium and received a Phase 2 grant from VentureWell. Did you know that schools are funded based on attendance? And that at least 11 million kids each year seek medical attention for a sore throat? That's $550 million lost each day by our nation's schools. Sore throat due to strep throat, a bacterial infection that requires antibiotics, is extremely common. By the age of 13, the average child will have experienced strep throat at least 3 times. And currently, the diagnosis of strep throat requires a physician visit for testing and a prescription for antibiotics. And since group A strep preferentially attaches to the tonsil located deep in the throat, testing can be physically challenging. A trained and experienced nurse needs to depress the tongue and quickly swab. And as you can imagine, testing is prone to user error. Poor sampling will lead to a false negative result. We are creating a non-invasive, user-friendly medical device to allow a non-clinician to test a child for strep throat. We use the same technology as the breathalyzer, with a sensitivity that exceeds the rapid strep test a child would have in a doctor's office. And here's how the Blue Comet strep test works. Attach a sterile disposable mouthpiece to the device and slowly exhale into it until the rim of the device turns blue. The exhaled breath passes through an array of sensors which sense the presence of volatile organic compounds, or VOCs. This constitutes the unique signature of the strep bacteria. The device then converts its data into a digital signal that analyzes it with its self-contained pattern recognition software. The arch of lights illuminates completely when the result is ready, and a positive sign indicates the presence of strep throat. Now, innovators have taken advantage of these VOCs for years, starting with the breathalyzer back in 2004, which correlates one's blood alcohol level with exhaled compounds. But over the past decade, more VOC detection devices are coming to the FDA for clearance for layman use, including GI-Mate, which helps people with Crohn's disease, and the TB breathalyzer, which diagnoses tuberculous pneumonia. Our initial go-to-market strategy is to target telehealth companies that are serving schools. By selling our device to the company, which is then given to the school, the telehealth company can bill for a strep test. Our device will then be simple enough for a non-clinician to use, which will allow schools without nurses to perform the test. The telehealth clinician can electronically prescribe antibiotics, and according to the American Association of Pediatrics, a child can return to the school after receiving the first dose. We realized early that selling our device directly to parents would be unsuccessful without pediatrician buy-in, and this is why we decided to approach the telehealth community. They want to use devices in their visits, and with the school-based telehealth model already in existence, we can use the telehealth company's staff to distribute our device to the end user. We anticipate that our success with school-based telehealth will show our device's reliability to pediatricians while being a non-invasive approach to diagnosing strep throat. We would then sell directly to physician groups for their use in clinic visits, and then to parents who can choose to use our device and connect with their pediatrician through a video visit or a telehealth provider. From our research, we have found that over 1,000 schools are contracted with telehealth companies to provide care for their students. Parents are happy because it alleviates the stress in scheduling and missing work when their child is sick. They sign a permission form to the school district, which allows a telehealth physician to care for their child and bill their insurer. In addition, the national government supports another 2,000 school-based health centers, which provide care for 1 million students. 1 out of 5 of these clinics uses telehealth regularly. We have already received letters of support from Hazel Health and the Global Partnership for Telehealth. Together, their reach is more than 5 million through school-based services. For our initial market entry, we'll be partnering with these companies to bring our offering to schools by integrating our device into their workflow. We're using a razor and blade business model. We'll provide the device to schools for a discount while charging for the sterile disposable mouthpieces separately. Mouthpieces will generate the recurring revenues during the lifetime of 1,500 tests for one breathalyzer, for a total revenue of about $5,400 per breathalyzer. Our breathalyzer unit will cost $129, and with the $5,300 mouthpiece revenue per unit, accounting for manufacturing and operating costs, we project a lucrative unit margin about 68% in our first year of launch. Currently, testing for strep throat only occurs in clinical settings by trained clinical staff. The cost associated with performing the test or purchasing the technology is high. And when considering over-the-counter diagnostics specifically created for layman use, results can be delayed for days since samples are mailed in or obtained invasively. Our device is the only option that is user-friendly and non-invasive, providing immediate results that can be used in conjunction with a telehealth visit. Strep diagnostics is a U.S. market size of 204 million, and our next step is to use our technology to increase our detection of pathogens to cover flu and COVID. Using our go-to-market strategy, we estimate our serviceable obtainable market at about $143 million, and we anticipate generating revenue in our first year of launch with a 5-year projection of that $143 million. By the end of the first year, we'll have completed our pilot study to obtain the Strep VOC signature and create our prototype, and our plan in the second year is to complete our clinical studies and receive clearance for our de novo application to the FDA in anticipation for manufacturing and distributing our offering in year 3. So here's our ask. We'll need $30,000 to complete initial studies and create a working prototype, and then the next phase we'll need another $270,000 to complete over a 12 to 18 month period to create our sensor and software components and human factor studies. In the final phase, we'll include validation of our device's accuracy through clinical studies, which we anticipate completing within 3 years. Rashmi and I founded Blue Comet last year, and we're planning to add members with business development and technical expertise. We've rounded our team with scientists, engineers, and founders that have successfully worked with the FDA to get their product to market. We have the founder market, product market, and technology product fit, and have already raised $75,000 in non-dilutive funds. We look forward to your investment in our success. Thank you.